Why do 70% of medical students struggle to remember the common peroneal nerve? The common peroneal nerve, also known as the fibular nerve, is a branch of the sciatic nerve. It wraps around the fibula, the bone on the outside of your lower leg, and then splits into two more nerves, the deep peroneal and the superficial peroneal nerves. These nerves are super important for movement and sensation in your lower leg and foot. The deep peroneal nerve controls the muscles that lift your foot, while the superficial peroneal nerve handles the sensation on the top of your foot and the outer side of your lower leg. Injuries to the common peroneal nerve can lead to foot drop, making it difficult to lift the front part of your foot. But don't worry, understanding this nerve is the first step to mastering it. So next time you feel that tingle, you'll know exactly what's going on.